Hello, this is Dr. Stanley Lang. Welcome to this presentation on osteoporosis prevention and calcium. Is it good or bad? The reason I wanted to share about this today was because of an encounter I had with a patient that was exactly on this subject. She has been just sort of on the verge of osteoporosis for several years, and we got to talking about calcium because she'd just been in the emergency room with a kidney stone. So, and she was taking calcium for her osteoporosis prevention, or that was the reason she had been taking it. So we got to talking about, is this a good idea or not? So I explained to her that the research that was done decades ago about using calcium to prevent osteoporosis was all done on people who were severely vitamin D deficient, but we didn't know it. So way back when all of the guidelines were being developed on how much calcium should be in the diet and how much you should be supplementing so that your bones could stay strong, all of this was done at a time when almost everybody in this area was vitamin D deficient, but we didn't know it. It wasn't even part of the thinking of the doctors. And at that time, the recommended dose of vitamin D supplementation was less than 1/10 of what we recommend now for to have healthy vitamin D levels and the other health benefits that come with vitamin D. So the point was that when you fix your vitamin D deficiency by taking enough vitamin D, your body becomes very efficient at extracting calcium from food. So if you're eating normally and having a normal amount of fruits and vegetables, and mainly vegetables, you're having more than enough calcium in your food for your body to extract it if you have fixed your vitamin D deficiency. Now, if you haven't fixed your vitamin D deficiency, you're not going to be extracting calcium very well, and you might need some extra calcium to meet your body's needs. But generally speaking, extra calcium only adds to more problems. It's more calcium than the body knows what to do with. And so what does it do with it? It sticks it in places where you don't want it, like in the kidneys, like in the soft tissue, including the arteries, and other places around the body that calcify gradually under the influence of age-related inflammation. So when we fix our vitamin D deficiency, we eliminate the need for calcium supplementation. So I no longer recommend calcium supplementation to my patients because I think it makes things worse if their vitamin D levels have been normalized, which is one of the things that I do work at for the patients that I have. And that way they have just the right amount of calcium for their bones to be healthy and happy, especially when you have the other amounts of the right nutrients, including vitamin K2, magnesium, boron, and silicon. When you have these key nutrients, the bones don't need any extra calcium that isn't in the diet already. So I encourage you to give some thought to this. If you're not really connected with a healthcare practitioner who can guide you on this, you might be wanting to focus on at least getting enough vitamin D in your diet. And the bare minimum for most of my patients is 5,000 units a day. So, but again, I encourage you to be guided by somebody, if you can be, who can give you some additional guidance. But calcium is going to do more harm than good if it does any good at all when your vitamin D levels are normal. So I wish you well, God bless, and have a great day.